presentation is proudly brought to you by the National Center for Wellness.
Welcome to the Childbirth Summit. I'm Dr. Rob Coombs, founder of the National Center for Wellness and host of the Childbirth Summit series. As a special guest today, we have Dr. Beverly Curtis. She serves as the chair of the board of directors of the United States Breastfeeding Committee and is a representative for the National Association of Pediatric Nurse Practitioners. Dr. Curtis holds her doctorate in nursing practice. She got the degree from Chatham University in Pittsburgh, Pennsylvania, and she is currently employed as the executive director of the National Breastfeeding Center, which is a for-profit consultation group focusing on the business of breastfeeding. Dr. Curtis' clinical role includes supervising lactation consultants as a pediatric nurse practitioner at the Breastfeeding Center there in Pittsburgh, and she's been practicing in primary care for the past 8 years as an international board-certified lactation consultant. She's practiced in a variety of settings, including maternity units, pediatric and neonatal intensive care units, and as outpatient pediatric clinics. She's conducted research on the Baby-Friendly Hospital Initiative and breastfeeding management, strategies to increase maternal milk volumes, and she most likes to help mothers and families learn how to be satisfied with their breastfeeding experience. So welcome to the conversation, Dr. Curtis. How are you?
I'm fine, thank you. How are you? I'm happy to be here today.
Fantastic. Thank you so much for your time. I am looking forward to a great conversation. It is a conversation that I'm very passionate about. I think it's absolutely critical that every parent at least discusses this subject and decides where they are and what they can do. But I think more and more the conversation is leaning towards the absolute importance of breastfeeding and why it makes such a profound difference for the baby. So thank you for your time.
You're welcome. I'm more than happy to discuss that with you today. It is also a passion of mine, and I hope that we're able to provide and answer some of the questions that the parents and listeners have today.
Awesome. This is great. So I want to discuss a little bit about just breastfeeding in general. So can you take me through a little bit about when you first got into practice, what the breastfeeding experience and expectation was culturally, and how that's transformed to where we are today, and even why moms should choose breastfeeding and what benefit it can provide? Can we just start with the history, and then I'll go from there?
Sure, we can start with the history. We can even start with the history of this is a system that's worked for millions of years. It is why we are here today. It is literally why mankind has survived.
Right.
So if we think of it in terms of the broader scope of history, it really does bring us from the millions of years ago to the present time.
Perfect.
In the last 100 years, though, our culture has changed significantly regarding infant feeding. And some of that was related to, even in the United States, the end of the Civil War, where there were many orphans and families that were left without, or they were fractured families, and mothers were separated from infants for a variety of reasons. And the industry that arose from that is the formula industry that we know today.
Wow. That
industry started making breast milk substitutes, milk that would be fed to infants when their mothers were not available. It was never intended originally to replace all of breast milk.
Right.
However, it has moved today from a short-term substitute to the way the majority of how infants are fed still here in the United States. It is not without difficulty that infants, when they receive artificial milk, there are health costs to the infant when they don't receive their mother's milk.
Sure.
So we want to be aware of that. Historically, formula started to be developed in the early 1900s and has changed and moved and been improved in the last 100 years. Pediatricians were the first physician practice that actually helped develop artificial milk, and they still today are considered some of the medical experts regarding artificial infant milk in the United States and worldwide. However, as it's been realized now through scientific research, that breast milk actually is still the superior infant food. It still promotes and protects the infant in all areas of health, and there are significant benefits from receiving breast milk for the infant as well as for the mother. For the infant, those benefits include protection from otitis media, or what we know as ear infections, protection from respiratory diseases, asthma, allergies. It helps protect an infant even from childhood leukemias. Many people are not aware of that,
Right.
from some diabetic diabetic illnesses and obesity. For the mother, what's very interesting is that breast milk also has protective effects. And so for the mother, she is protected from premenopausal breast and ovarian cancers. She also has a protection from cardiovascular disease when she breastfeeds. Breastfeeding inhibits ovulation, so it can act as spacing for childbearing,
Right.
and often used especially in the third world for that reason,
Right.
as well as in developed countries. So there's many advantages to the family to breastfeed, for the mother, to the infant, but also to the father, in that he has a healthier child and a healthier partner, as well as the economic benefits, which include that breastfeeding is mostly free
Yeah, absolutely.
compared to the cost of artificial feeding.
Absolutely. I love that you included the dad on that, because it's important. We've talked on other calls about the importance of dads being on board with and supportive of nursing and breastfeeding, and what an impact it has. When the dad's against it, that can be a devastating impact, and when the dad's for it, it can be such an impactful insurance that mom is going to actually follow through. So it's critical, and that's a mission for me as a guy that I love to get into.
Right.
But that's a great history going back from the Civil War through, because it makes sense that with orphans, where if you did lose the mom, if there were separated kids and there's no way to feed them, you're trying to find a way that will substitute, and it gets into the conversation of can and should. Can you eat other substitutes of milk? Absolutely. Should you? If you have to, but if you don't, if it's not an absolute necessity, there's nothing like the real thing. So
Sure.
that's absolutely amazing. And I love that you talk about some of the health issues and some of the not only the benefits, but what you can avoid from the disease side of things, from not only the baby, but absolutely the mom. We talk all about the hormones that are produced in the body, with a different speaker in the series, and we talk about getting the body back into shape and the uterus contracted as much as possible, which sadly tends to be the primary concern for a mom is getting back into pre-baby status, how she looks. But all of them are all supportive of the fact that it's a critical decision, critical importance. What have you seen just in the last 10 years in terms of trends and patterns with, I'll say, I see an uptick in terms of number of people breastfeeding.
Right.
How do you see that trend? Where do you see it, and where do you see it going?
Well, the trend now is that many more mothers are breastfeeding, and there's a lot more support available now than there used to be. Just in 2011, the Surgeon General, Regina Benjamin, had a call to action to support breastfeeding. And in her call to action, she said, everyone should make breastfeeding easier. And she identified numerous areas in our culture, in our support systems, in our hospital systems, in our communities, where mothers need help with breastfeeding and need support. And I think that although prior to the 2011 mark, there was a lot of momentum towards improving breastfeeding in hospital systems and healthcare systems in communities, her call to action really was a springboard to help many organizations bring breastfeeding to the forefront, to highlight the support of breastfeeding, the protection of breastfeeding, and the promotion of breastfeeding in businesses, in communities, in schools, in hospitals, and in our nation. So the landscape of breastfeeding, is what we call that, has changed significantly in the last number of years. The Centers for Disease Control have been a leader in that area, where they've collected data on breastfeeding. They've collected reports state by state and hospital by hospital to identify areas that need improvement. They actually have surveys that they send to hospitals and send to states, so that we can actually identify the areas of need and the areas of concern within the breastfeeding communities to know how to address those issues and improve those issues. So the Centers for Disease Control have been significant in that. Certification bodies that certify hospitals have also contributed significantly to the improvement of breastfeeding. The Joint Commission has now identified perinatal care core measures that promote breastfeeding within hospitals, asking hospitals to identify those mothers who are exclusively breastfeeding and providing, or exclusive breast milk feeding is what they call that initiative in the hospitals. They've also done a campaign for mothers just to say, ask for help with breastfeeding while you're in the hospital. So this has been a very significant campaign. Other campaigns have focused on state-by-state initiatives. Health departments within each state have now asked hospitals to promote breastfeeding practices that are evidence-based through these state campaigns identified as Texas has the Texas 10 Steps. Pennsylvania has just started the Keystone 10. Okay. There's other initiatives in other states that are moving forward. Maryland has one as well. There's many now where the health departments are the leaders in helping the hospitals actually move forward in evidence-based practice for breastfeeding. And this has made a significant difference in our communities in that the hospitals are no longer in competition with each other, but working together to promote breastfeeding. And I think these are some of the most significant changes in the last several years.
That's beautiful. Now, you talk a lot about state to state. You talk about just hospitals working together. I want to take a second to step aside. Can you talk a little bit about your business, what it is you do, and then I want to talk a little bit about your other role. So let's start with your business and your company. And as a company, what it is you're focused on doing and improving and how you do it.
I serve as the executive director of the National Breastfeeding Center. And the National Breastfeeding Center is a business that focuses on the business of breastfeeding for anyone who's interested in improving their business practices of breastfeeding. This would include hospitals who actually have, once they achieve baby-friendly status or evidence-based practice with breastfeeding, actually have a more loyal patient base to work from. These initiatives in the hospitals are sometimes hard to promote because of practices in the past that have been of habits, practices that relate more to the nurses' roles and the physicians' roles rather than meeting needs of patients. So it is changing practice in a way that's evidence-based, that is supported by literature that would promote breastfeeding. We help hospitals do that, and we help them move towards the Baby-Friendly Hospital Initiative, which is the international certification that identifies hospitals as having evidence-based practice in breastfeeding. We also help employers. Employers have identified that there is now a federal law that requires them to have a separate space provided for mothers so that they can pump in a space that's clean, in a space that's not public, and provide that time for mothers to pump once they return to work. Since this is a barrier to most mothers in terms of breastfeeding, a lot of women will choose not to continue to breastfeed or not to breastfeed at all because they identify going back to work as being very difficult in being able to continue to breastfeed. Now the federal law requires that employers provide that space for mothers, and we help employers do that. There's a lot of problem solving sometimes involved with this, in that there may be limited space available. There may be, it may be identified that to take that worker off of an assembly line to pump might be difficult, but with collaboration and cooperation of the employer and ourselves, we're able to help them problem solve and provide that space for their employees. It is a short period of time, and they find that when employers do that, their employee actually has more loyalty to the company. Right. They actually return to work a little sooner, and they miss less days of work. Sure. Why do they do that? Because they have a healthier baby. Yeah. They have a baby that is not ill, is not being removed from daycare because of illness, and mother has to stay home then with the baby. So it is a win-win situation for the employer, for the mother, and for the community. Another area where we work in the National Breastfeeding Center is to help physician offices or medical practices support breastfeeding with their patients. A lot of times it's identified that this is another area of concern for providers in that it's thought that breastfeeding takes time to help support a mother, and the busy physician may not have that time built into their practice. However, we have models of care that we can discuss with the physician offices, with medical practices, so that they can actually provide that care on site as the need arises with brand new mothers and infants. And this is a very critical time in the mothers and infants' lives, usually day 3 or 4, when they're first having their appointments in their physician offices, all the way through the first 6 weeks of postpartum care for the mother. And we can certainly help physician offices identify how to set up coding and billing for these services and how to pursue the best model of care for their practice.
That's fantastic. A lot of, like what you're saying about the businesses in setting that up, I think that's a huge part of something as a responsibility we need to do and a priority we need to make. Mm-hmm. And as you were talking, I was thinking about productivity too, is that if you work as an employer to allow a mom to have that time to pump, mm-hmm. I think the employee on the flip side values that and gets the same work done in a shorter period of time to still have to still have the time to pump. That I think productivity wise, you'd find that you're not losing out.
That is correct.
It is a win-win because you're giving the mom that opportunity.
One last thing I would like to identify is that since August 1st, 2012, the Affordable Care Act has identified that insurers provide breastfeeding and lactation services for mothers without cost to the mother. Right. The other issue with that is that insurers have interpreted that law in many different ways. So the National Breastfeeding Center has also done a fairly complete review of insurance policies that are available nationally, and we've scored those insurers as to how they support breastfeeding and lactation services.
Awesome.
We actually have a scorecard available. So if a mother would have a question regarding whether her insurer actually covers breastfeeding and lactation services, she could look on our website to find the scorecard and see where they rate in terms of their breastfeeding and lactation services. And they are graded from A to F. So she would get just a good snapshot of what her insurance could provide for her by looking at that grading system.
That's awesome to grade them and let them know that they are below average in what they are supporting and offering their clients. That's brilliant and a wonderful tool to have. So thanks for providing that. On your other role, you are chair of the United States Breastfeeding Committee. Can you talk about that committee and the work that it's doing and who the members are that are helping to support those changes?
Sure. The United States Breastfeeding Committee is an organization of organizations. And what we mean by that is we have 50 member organizations that come together with representatives. And we discuss policies and issues relating to breastfeeding in the United States. We have members, representatives from many different healthcare organizations, as well as mother support organizations and organizations in between. So some of the organizations that are there, the American Academy of Pediatrics, the American Nurses Association. I represent the National Association of Pediatric Nurse Practitioners. There are mother support groups there, such as Moms Rising, La Leche League International. There's Lamaze International. There's many, many groups available. I could name all 50. I'm not sure we have time on our webinar today. Okay. But each group sends 2 representatives. We also have voting members as well as advisory members that belong to our committee. And what's unique about the United States Breastfeeding Committee is that we collaborate with many organizations, and we have opened our doors for many to join us in our work nationally.
Great.
Some of our work that we focus on are the maternity legislations that are in our nation today. We're looking for breastfeeding laws. We help to support breastfeeding laws state to state. We work to support work within the communities. Our focus right now is racial equity and diversity, in that many women of color have not had access to breastfeeding care the way that other mothers have in the United States. And so we're working to address those issues so that there's equity in terms of breastfeeding and lactation care and access to care in all communities.
That's great. Yeah, that's a conversation that came up on the last summit that we did, and it's great that you are addressing that and providing resources and at least attention to help correct that disparity. That's fantastic. When you talk about just getting back to moms now and ideas that are important for a mom that's learning to breastfeed, what are some basic ideas that are important for a mom to know that'll make a profound difference for her?
That's a great question, and there's many ways to answer that question. I would say two areas that mothers need to understand is one, she needs to feed the baby, and she needs to always work to build her milk supply. Those things often go together and come hand in hand, and one follows the other excessively well when breastfeeding goes well. So if she's offering the breast frequently and often, then the breast makes what's taken from it.
Right.
So as she's nursing well and the baby's actually transferring milk, the breast responds and makes more milk for the next feeding. So those are two things we just want to be aware of. You always feed the baby, and you always build a milk supply if she's separated from the infant in some way.
Right, especially at work. How about when a woman is first starting out nursing, especially right out either at the hospital or when she's home and now sadly isolated in the home and doesn't have somebody that's right there. What are things that are important for a mom to know when they're first starting out? Things that'll ensure the success for nursing.
Right. I think there's a lot that happens in the first hour that can be very helpful to establishing breastfeeding. We call that the sacred hour, the golden hour, the hour of power, however you want to discuss it. It is that first hour after delivery. If for some reason mother and baby are separated, it isn't that breastfeeding is lost at all. Right. However, if she's with her baby in the first hour, there are things that she can do to facilitate breastfeeding rather well. And the first is just put the baby skin to skin. What does that mean? She holds the baby skin to skin, meaning the baby's skin is against her skin on her chest, and both are covered with a blanket. This is an initiative that is often used in hospitals today. Not every hospital is doing it yet, but it does a couple things. It helps regulate the baby's temperature. Mother's body temperature actually will raise to help keep the baby warm. Okay. And so in that first hour, we want the baby warm, we want the baby comfortable, and the best way to do that is hold the baby skin to skin. It also stabilizes the baby's blood glucose, which is an area of concern after delivery for some babies. And this is a great advantage to hold the baby skin to skin because it does stabilize that blood glucose, the temperature, and then it also facilitates feeding. So babies who are held skin to skin will actually naturally begin to root and look towards the breast for feeding, and they will self-attach. They'll just find their way and attach onto the breast. Typically, if they're not under the influence of other medication for some reason. Sure. So those babies may be a little slower to self-attach. However, they still have all the advantages of skin to skin when they're allowed to do that. So skin to skin after delivery is a very important first step in learning how to breastfeed. The second step is to offer the breast frequently and often, every 2 to 3 hours after delivery. This helps the baby start to build a milk supply and helps feed the baby. So offer the breast frequently and often. If you don't know what's going on with your baby, nurse first, ask questions later. So a lot of people will walk the baby, offer a pacifier, try to burp, try to change the diaper, all these things when truly the baby just needs to nurse. Right. So breastfeed the baby if the baby starts to fuss. Look for early and frequent feeding cues. Often mothers think, I'm not going to feed the baby till the baby starts to cry. Right. Actually, crying is a very late feeding cue. Sure. A feeding cue is actually the baby talking to you. It's the baby telling you, gee, I need to feed again. And those things happen with a swipe of the hand by the face, the tongue coming in and out just a little bit, right, just indicating maybe the baby opening their mouth a little bit. All those things are early feeding cues and telling the mother, time to eat again. Right. So if she's offering the breast during those early feeding cues, actually, she has some time. She has some time to be able to bring the baby to breast, position the baby, and get the baby latched. If she's waiting for the baby to cry, it may well be it's a lot harder to feed a crying baby. Right. So she has to calm the baby down, try to focus on maybe swaddling, doing all these things before putting the baby to breast, where she responds to those earlier cues. Often she has a little bit of an easier time. Not every baby gives a lot of feeding cues. There are some which I call no-nonsense babies, and they just wake up, they cry, they're ready to eat. But as mothers learn the pattern of communication that her baby gives, she can also know when it's time to feed. She should also follow the inner mothering that many mothers have, right. That intuition that, gee, I think my baby needs something now. Mothers should not ignore those signals that she gets inwardly about the parent her child. So that's a very important piece of learning to mother, and actually to build confidence as a mother to follow that intuition. If something seems wrong, ask. Sure. If something isn't quite right, seek help from your pediatrician, from the obstetrician, from a lactation consultant, from a nurse, or another helper that knows something about infant feeding. Right. It's really important to follow those tips and cues in your own life. So, and that will give the mother more confidence in learning how to feed her baby and how to mother. She should monitor her progress. So if she's not sure how things are going, she should see her physician, her pediatrician, the baby's healthcare provider, in about 2 to 3 days after discharge. Right. This is a critical point because a lot of babies at day 2 to 3 or 4 have their lowest weight. All babies lose weight after delivery. They pee off extra fluid. We call it diuresing. They diurese and they pee off extra fluid. And so their weight is lowest on day 3 to 4. This is the time that the American Academy of Pediatrics suggests that babies be seen by their healthcare providers for a feeding check, a jaundice check, and a weight check on day 3 to 4 of life. If she has that checkpoint then she knows what she needs to do from that day forward to be more successful with feeding. And so it may well be that the baby's well within the correct parameters in terms of weight loss and not an issue. However, if the baby has lost a little too much weight, she may need to nurse more frequently, help build her milk supply, and follow the advice of her healthcare provider.
That's great. Now, a lot of parents, when they are seeing their doctors and they're getting the feedback on the growth scales and things like that, mm-hmm. Every baby's different and everybody's milk supply is different. But I would say the average response is that a baby on formula will tend to be a little bit heavier on the weight gain. So it'll be higher on that weight scale, which means women who are nursing are going to have babies on the lower end of that weight scale. And nursing moms often find that they have a much harder responsibility in the middle of the night because the baby isn't going a number of hours, 4, 5, 6 hours through the night with feeding. So can you talk a little bit about the importance of reorganizing values, that it's not a matter of the priority isn't to sleep? A lot of moms will say, the benefit of the formula is that the baby sleeps through the night. And I always want to come back to what the real value should be focused on, and it's not sleeping through the night. So how do you transfer or shift the focus from parent benefit to baby benefit, and encourage moms to stick to the hard routine of getting up a number of hours in the night, even though it may be more difficult, that it's in fact the right thing?
I think those are some questions. We all like sleep. Everyone loves rest and loves sleep. And if we're especially looking to going back to work at some point, mothers want to be rested when they go back to work. Right. Parenting is hard, no matter how we feed our babies. And the babies haven't necessarily read all those books, right? So they don't know all the things that they're supposed to be doing. Right. You want to keep a couple things in mind. That is that new mothers need to guard their rest carefully, no matter how they feed their babies. So if they're resting when their baby's resting, and they're doing things that protect their rest during the day for the first 6 weeks, they're more likely to recover from childbirth sooner, no matter how they feed their baby. Right. If a new mother is feeling good on day 3, 4, 5, or week 1 or week 2, and does too much, often it will set her up for excessive fatigue that is hard to recover from. Sure. It takes about 6 weeks for new mothers to replace the blood loss that they've had during delivery. Just physiologically, it takes that long. So to do too much too soon can stress the body in a number of ways. With breastfeeding versus formula feeding, babies who bottle feed don't necessarily sleep through the night in those early weeks of life either. They also tend to have a little more problems with constipation and other difficulties related to digesting formula that could lead a mother to be up in the middle of the night with a crying baby. Right. So breastfed babies tend to feed every 2 to 3 hours. Another way to look at it, though, is they need 8 to 12 feedings in 24 hours. When a parent comes to me and talks to me about how their baby's been up at night a lot, usually it's because they've slept during the day a lot. And so I try to ask them, how long is the baby sleeping during the day, and how long is it between feedings during the day? If we feed more frequently throughout the day, you're more likely to have a baby who has a longer stretch at night, who sleeps. Right. Breast milk digests fairly quickly, in about 2 hours. In an hour and a half to 2 hours, amazingly enough, the breast remakes that milk in about an hour and a half to 2 hours. So the breast is ready to feed the baby again. It also digests extremely gently and efficiently. Sure. So that milk is readily absorbed in the baby's system and utilized extremely well. Formula is a foreign protein, does take longer to break down, and so may stay in the baby's belly longer, right, but it may not lead to longer stretches at night overall. When you look at the research, not necessarily so. It is the perception of society that, well, if you feed that bottle right before bedtime, the baby's more likely to sleep. If you feed the baby throughout the day more frequently, you're more likely to have that baby sleep at night. There is no guarantee as to what babies will do and how much sleep you'll get. However, there are ways that you can improve that system, and one is frequent feedings throughout the day. Also, when you're caring for your infant at night, it's much harder, no matter how you feed your baby, to walk down the hall and around the corner into another room to take care of your infant. It just is much more difficult. The suggestions from the sleep experts addressing sudden infant death syndrome suggest that babies sleep in a separate sleep surface, but within the parent's room. Right. And so that you have easy access to your baby, no matter how you're feeding your baby. Yeah, and sense. Also an easy way to observe the baby at night so that you know that your baby's sleeping safely.
Which ties back to exactly how it was no doubt done for the last million years up until just recently, when we had multiple bedrooms and whatnot, that we could do those things. So
that's right.
Yeah, that makes sense. Earlier in the conversation, you mentioned evidence-based research.
Yes.
Can you talk about what that is for people and how it's become the standard, the best standard, and what we would then compare it to, and just a little bit about how that's been a lot of the reason how we've created the momentum shift of changing policies and paradigms.
So for many years in the medical field, a lot of caring for the patient was based on the convenience for the nurse or the physician in terms of physical space and what worked best in a routine and how it was always done, so to speak. Right. Then evidence-based practice came into being, which is looking at these models of care, looking at specific clinical issues, and actually studying those issues to see which works best with patients. The Joint Commission actually was one of the very first groups that talked about evidence-based care, and they are the ones that developed standards for care in hospitals. Now, there's many disciplines who look at evidence-based care, and that is literally comparing methods of care in a clinical trial, if you will, through randomization, right, through many different ways to identify what type of care works best for which patient. So evidence-based practice is a scientific way to determine what works best in patient care.
Yeah, that's fantastic. And it makes sense when you look at it, and especially, you can't do a double-blind control. Once you do one thing, you have no way of doing the other. So, clearly makes sense. And the other question I had for you is based on the committee work, where's the stance? Where's the conversation with the amount of time in America with the return to work? I feel like in so many countries, especially in Europe, they've such a better program and time set up where moms and families can be together at home. Where in America, it's such a short, ridiculous time frame that it's starting to have an impact on the health of the family. Where's that conversation at so far?
Well, that's a great question. I would say that that conversation is evolving and moving as we speak. There's been lots of work within the Department of Labor looking at ways to promote and protect breastfeeding on a national level. The Obama administration has addressed these issues regarding protection for maternity time so that all workers in America could possibly have paid maternity leave. Obviously, this is not hasn't come to fruition yet, but it is at the conversation and at the table with top administration now, identifying that as mothers have time to spend with their infants, it actually establishes the family unit in a more significant and impactful way. It helps impact the health of our nation, the health of our children, and the health of our families.
Yeah, and I see it as we had for a while, especially in America, had this swing towards business growth, business bottom line, and I feel like the value is swinging back towards just the value of family and community and centering that, and then building the rest of the pieces around that. So I see it as a critical change that needs to happen, and I'm glad that you guys are at the forefront of helping to ensure that policies change and timelines lengthen for the family.
Yes. And I think in the next 5 to 10 years, we'll see some significant improvement in those areas.
Fantastic. That's wonderful. So I appreciate your time. Any last thoughts? Any last items you'd love to interject or leave as a thought for especially families who are either breastfeeding or thinking about it and needing to learn more information?
I would think that mothers need to know that any amount of breastfeeding is better than none at all. If she chooses to breastfeed one day, that gives her baby that foundation for immunity that the baby would not have received if she never ever offered the breast.
Perfect.
So one day of breastfeeding is significant, and it is a great choice that a mother would make. If she chooses to feed another day, that's great too. So we should really celebrate any amount of breastfeeding that a mother does.
Right.
Lots of times mothers choose not to breastfeed for a number of barriers that we can help her see through. Perfect. And actually jump over. Yeah, right. If we would have those conversations with mothers. Some of those barriers are cultural barriers or community barriers with her partner, with her family, where they're not quite understanding what breastfeeding is about. So we should provide that education to those mothers and their families. This can be done in churches. Sure. It can be done in civic organizations. It doesn't have to be done in the doctor's office. Right. That's why anyone can make breastfeeding easier. The shortage of breastfeeding care providers is significant. So mothers need to identify early where they will go for help. If they can identify support groups in their community, La Leche League International, other mother support groups are often very helpful, or local lactation consultants. That's where she needs to do a little bit of work ahead of time. Right. So she knows where she can go for help and for care.
Perfect.
And the lack of maternity legislation is another issue that we've discussed. I feel that is an area where if someone wants to work in their community or in their state or nationally to help promote that, even write a letter, that would be very, very helpful. And then, of course, the marketing of breast milk substitutes is still a difficult issue in this country and influencing lots of mothers' choices regarding infant feeding. So if you can go to your hospital or local healthcare provider and ask that they not promote the marketing of breast milk substitutes, meaning they don't hand out free formula, they don't use brochures from formula companies, but create their own educational information and brochures, that might just make a difference for one or two mothers in that community, as well as mothers throughout the state.
That's huge. That's great. You mentioned the letter to a local representative or a state representative. Do you happen to have a copy or a sample letter that somebody could use or at least a format to follow to be able to write something like that?
Where you find that information is the National Women's Law Center has a number of sample letters that mothers could use depending on their situation and what they're looking for breastfeeding support and help. So I would refer you to the National Women's Law Center and see their entire section on breastfeeding help, support, and legislation.
Perfect. That's great. They will have the link so that they can follow that. That's fantastic. Well, I certainly appreciate your time today and all the work that you're doing to help ensure that breastfeeding is something that returns to what it once was, if not 100 years ago, for the past every generation before the latest few. So thank you for your work and for your time today. Appreciate it.
Thank you. Thank you very much. It was a pleasure.
Awesome. I am Dr. Rob Coombs with the National Center for Wellness and the Childbirth Summit. Get well soon.